shifts, working 3 shifts. What's your advice?
You know, at this point, our strongest advice is that people that are sick need to stay home. Those companies that are in areas where we're having significant cases, if they can, telework, we're recommending that. Those companies that are where with cases, we're asking for social distancing. We're not asking for everybody to come at the lunch.
Shifts, working 3 shifts. What's your advice?
You know, at this point, our strongest advice is that people that are sick need to stay home. Those companies that are in areas where we're having significant cases, if they can, telework, we're recommending that. Those companies that are where with cases, we're asking for social distancing. We're not asking for everybody to come at the lunchtime and sit at the same table. We put out a series of guidelines. But what we're not advocating, and obviously individuals that just returned from Italy or France or Germany, we'd like them to stay home for 14 days. But we're not advocating the use of these tests in a broad way in the absence of a relationship with a physician or public health official to make that determination.
Second question. We've got probably 80 people in this room. The questions that I'm getting asked, in this room today, what are the likelihood? I don't know who's got what in this room. Walk me through the likelihood of any one of us in this room getting the virus, assuming somebody here has the symptoms.
Again, still the real risk in general right now, and this is why the president took the action he did last night. Within the world now, over 70% of the new cases are linked to Europe. And in the United States, I think it was now 30 states in our country, 30 states or more were linked actually to cases of Europe. Europe is the new China, and that's why the president made those statements. Clearly, we can only continue to emphasize the basics that we've all said about washing your hands, obviously staying away from people who are sick, learning how to cough correctly, don't touch your face, although we all know it's very complicated, to try to not touch your face during the day. But I think it's really important that we also are moving quickly with broader mitigation strategies based on the virus, and Tony may want to add to this. So some of that is really encouraging social distancing in the workplace, really encouraging social distancing in restaurants, really encouraging social distancing at sporting events. So Tony, you want to add?
Yeah. So sir, it's a great question because you're right, everybody's asking it. And the issue is, in the spirit of staying ahead of the game, right now, we should be doing things that separate us as best as possible from people who might be infected. And there are ways to do that. We use the word social distancing, but most people don't know what that means. For example, crowds. We just heard that they're going to limit access to the Capitol. That's a really, really good idea to do. I know you like to meet and press the flesh with your constituencies.
Not now.
I think you need to really cool it for a while, because we should be practicing mitigation even in areas that don't have a dramatic increase. I mean, everyone looks to Washington State, they look to California, they're having an obvious serious problem. But their problem now may be our problem tomorrow. So we've got to act like there's going to be a problem. And that means doing everything you possibly can to do the guidelines that the CDC puts up, which sound very simplistic, but they're really important.
Common sense.
Common sense, yes.
Finally, I know when this first became public, I think this country had test kits out in an effort to find a vaccine to those willing, I guess, to be tested. Where are we on that?
I want to just sort of stress the complexity of getting tests, as we've heard from a number of your colleagues, is not just about having the reagents that CDC originally made for a test. You obviously need that test kit, and we've put out in the public health system over 75,000, so the public health labs have that. But the public health labs actually have to have the people to do the test. And what is their capacity to do the test? They have to have the equipment to do the test. And what's the capacity of the equipment they have? They have to have some of the early reagents that they need, not to get too technical, but you got to extract nucleic acid in order for the test to go into our kit. So there's a whole system that we can see that there's different, limitations as we expand. CDC, I tried to explain why we use the system we did, which is a thermocycler system, which is not a system that you can do, tens of thousands of tests very easily. You're really limited.
Do what we need to do.
The head of U.S. forces in the Middle East says an Iranian-backed militia likely launched the attack that wounded an additional dozen coalition troops.
Its economy remains strong. The president is continuing to take action himself. We just passed billions in urgent funding just last week, and the Senate will continue to stand ready and willing to work toward further bipartisan actions when the House Democrats decide to get serious.
Now, yesterday, Madam President, the World Health Organization officially declared COVID-19, known as the coronavirus, a pandemic, saying that it was, quote, deeply concerned both by the alarming spread and severity and alarming levels of inaction by the nations of the world. Let me repeat that. They were deeply concerned both by the alarming levels of spread and severity and the alarming levels of inaction by the nations of the world. In my home state of New York, members of the National Guard have arrived in New Rochelle this morning to clean institutions and deliver food to the more than 120 sick residents within the 3-mile containment area. Here in the capital, public tours will be suspended, and by the end of the week, the Capitol complex will be restricted to official business only. And today, the House of Representatives will take up and pass several measures that the Speaker and I called for earlier this week to alleviate the economic pain felt by American workers and families that are impacted by the coronavirus, including extension of paid sick leave, food security insurance, and an expansion of unemployment insurance. The legislation will also provide much-needed help to states like New York that are overburdened by Medicaid costs by temporarily modifying the FMAP formula. It gives the states the flexibility and money they need to fight this problem. I have long fought for an increase in FMAP funding, and this is welcome and needed for New York. I'm glad it's in the bill that Democrats in the House and Senate put together. Now, many of the policies that I've mentioned have been enacted by other countries dealing with the coronavirus. The policies are targeted at workers and families that are directly impacted by the virus, which is exactly where the focus needs to be. Not on bailing out oil and gas companies or the cruise industry or deregulating banks. Some of the ideas under discussion at the White House by all reports, but on helping the American people cope with the crisis. That is job number one. We can come back and pass additional targeted measures that deal with other economic problems at a later date. But in the immediacy of today, the policies that the House will pass will provide much needed help to those who need help. It will provide significant economic relief by pumping money into the economy, and it will provide some flexibility to the localities, the states, and to the American people. The Senate should pass this bill immediately following the House before the end of the day. I plead with my Republican Senate colleagues to pass this bill now. It has been carefully thought out. Its programs are directly aimed at people. They're not ideological. And it is desperately needed to show the American people that we can do things that actually benefit the people who are in trouble and actually help move the American economy. To not pass this bill today would be a dereliction of duty. and I plead with Senator McConnell, put the bill on the floor. Let there be a vote. It will pass, in my judgment. Put the bill on the floor. Do not let this legislation that the House passes at a time of crisis be just another tombstone in your legislative graveyard.